Yeah, as you will know, we're talking about business robbery. We're also talking about issues of sexual assault as well as kidnapping. I can say that we have had sporadic incidents in the area, especially from December coming to January. But I'm told that there were other community members who said that recently there have been about 9 cases that were reported. We would like to refute those claims. Those claims are unsubstantiated. We have our own stats. I can tell you now, this is not a problematic policing area as compared to your Thohoyandou, your Seshego and Mankweng. This could be a sporadic incident. We would like to believe that we could be having a serial rapist in this very area, but we are working very hard to apprehend the suspect, and we believe that our multidisciplinary team will do their work in this regard. As you will have noticed, even during the festive season, we have had some murder cases that we were able to resolve, complex murder cases. We have been able to arrest the suspects. The same here is going to happen. I can definitely assure you that we are going to arrest the suspect. The PC will come out strongly after we have arrested the suspect to say that we have indeed arrested the suspect. We are very confident in this case.
And following this incident at Ga-Chuene Clinic, Democratic Nursing Organization of South Africa, Denosa, is calling on the Department of Health to temporarily close the clinic and suspend night shifts until the situation is resolved. Additionally, Denosa is appealing to community members to come forward with any information that could lead to the arrest of the perpetrators.
As Denosa, we are devastated and shocked by the incident which happened at Ga-Chuene Clinic this morning. As the organization, we really condemn the incident because the incident really reversed all the progress that was made in terms of ensuring that the communities access health services even after hours. As the organization, we did hold a meeting with the department this morning at the clinic where we made a submission that number one, the affected nurses must be given the psychological and physical support as they are traumatized, and then indeed the department referred them to the hospital. They are receiving assistance from the psychologist. And secondly, the clinic, we made a submission that the clinics be temporarily closed to ensure that their colleagues also receive psychosocial support as they are also traumatized. And we lastly make the department to close the night shift or night duty services indefinitely until the situation is normal in the clinic. And what is really concerning us is the competence of the security company which is deployed in that facility, because we are still having questions without an answer, because is this really unbelievable that one particular person, even if he's armed, can overpower 3 security officers? So those is our position as the organization. We really condemn the situation or the incident seriously so. And we are calling upon the community members because we believe that the perpetrator or perpetrators, they are familiar with the clinic, which make it possible that they are the residents within Ga-Chuene Clinic. We are calling upon the community members to come forth, assist the police with the information which can lead to the arrest of that perpetrator or perpetrators. We are going to have a follow-up meeting with the department on Monday. One of the issues that we are going to raise is that the competence of those security officers, because we are not even sure whether those security officers were capacitated enough to deal with such kind of situation where the facility is being attacked. Number 2, we believe that the department must also ensure that the security companies employed in our facilities, they comply with memorandum of agreement as it was clearly indicated that one of the security officers in the facility must be armed. So currently, as we check, there's no clear indication whether those security officers were armed, of which we believe that the people who attacked the clinic, they have made a thorough assessment, and they were quite aware that the security officers are not armed. So we are putting the blame on the security company. We are also not leaving the department in this situation, because it's the responsibility of the department to ensure that the security companies complies with the agreement of the memorandum of understanding in terms of ensuring that one of the security officers is armed. And again, in terms of the 24-hour service policy, the clinic must be manned by 3 security officers, of which one must be deployed at the gate to maintain access control. The other security officer must be in the clinic with the nurses to ensure that as and when the patients come during the night, they don't put the lives of the safety of nurses at risk.